opening today is a tribute to the fallen, but it is also evidence of hard and constant work put in by those who have formed the committees over the years of preparations. A hospital is not judged by its exterior looks. It is what goes on inside that counts. And as good results are obtained in the smallest places as in the largest.
This simple yet poignant message delivered by Sir Ernest Weary Dunlop at the official opening of the Numurkah District War Memorial Hospital in April 1957 had a powerful and lasting effect in shaping the legend behind the town's health service.
The hospital was dedicated as a memorial to those who had given their lives at war and to express the gratitude of the people for the freedom that had been won. It was with this strong and proud foundation that Numurkah District War Memorial Hospital served its community, carrying those same values and beliefs to its present day.
In the 55 years since that official opening, Numurkah District Health Service, as it is known today, has experienced many triumphs, challenges and periods of change. And as the hospital now embarks on a major rebuild and an exciting new era of health service provision for the district, that original message still holds fast.
A hospital is not judged by its exterior looks. It is what goes on inside that counts.
The idea of a war memorial hospital at Numurkah was originally conceived during the Second World War, and in 1945 a provisional committee was formed to raise £15,000 toward the construction of a 30-bed public hospital.
The town was already provided with a fine memorial erected after World War I, but the committee felt that a utilitarian building and service would be more suitable. Also, the town was only serviced by a private hospital, and as the town and district was expected to grow, the committee felt that a 30-bed hospital would be adequate for a considerable number of years. At the same time, the Charities Board was busy planning Victoria's hospital needs, and it considered that a 46-bed hospital with provision for development was more in keeping with the expected population increase at Numurkah.
The work of the Provisional Committee continued for a number of years, and in 1947 a block of land in South Numurkah, upon which the present hospital is situated, was donated by the Moss, Trengrove and Holmes families.
4 years later, in 1951, plans were drawn up for the construction of a 2-storey building designed to accommodate 50 beds with the provision to expand to 70. These bed numbers were calculated on the basis of 9 beds to 1,000 population ratio, utilised as the planning guideline for that period. Around the same time, the Provisional Committee purchased the Penzance Private Hospital for £5,200, and the 16-bed facility was used as a midwifery ward. During the building of the new hospital, a service was maintained at Penzance by tenants of the committee, but this scheme did not work well. In 1955, the Provisional Committee itself was superseded by the District Hospital Committee, one of whose first tasks was to reorganise Penzance.
Plans went ahead with the new hospital project and it was decided to erect a nurses' home prior to the building of the hospital, which would provide accommodation for workmen engaged in the main project. It was a Bristol building of aluminium construction that was imported and set up on a concrete base on the eastern part of the land. Some of the rooms were only 8 foot wide and we had to knock out walls to make wards.
The hospital program went ahead. Architects produced plans for the main buildings and tenders were called. The lowest tender of £430,000 was eventually recommended. In 1955, as a result of a state election and a change of composition of the government, the Hospitals Commission was changed under the new Health Minister.
The Commission examined the hospital building program in Victoria, and it was decided that any project not actually under construction should be held up to allow time to examine alternatives. As a result of this decision, it was determined that the existing plans at Numurkah would not be realised, and that the nurses' home in the Bristol building was to be converted into a community hospital. A plan was produced converting this building into a hospital of 17 medical and surgical beds, theatre, nurses' quarters, kitchen block and administrative offices. The first patients were admitted to the new hospital in November 1956.
5 months later, on Saturday, April the 13th, 1957, the new hospital was officially opened by Dr. Weary Dunlop in the presence of town and district residents. Dr. Weary described the hospital as a fitting memorial to those killed in war. He said,
It is a good thing to have such memorials that work for the uplift of mankind. Hospitals are lasting memorials. Numurkah and District War Memorial Hospital has splendid medical men, competent and sympathetic nurses, a good manager and an enthusiastic and capable committee. And there should not be any doubt that the hospital will be successful.
after the official opening, midwifery patients continued to be treated at Penzance, where there were 16 beds available. However, the hospital committee and the Numurkah community were not satisfied with the present setup of two hospital units so far apart. It increased expenditure, added to the staff difficulties, and decreased the efficiency of the service. In 1962, the two-campus hospital was amalgamated into the present site with the closure of Penzance Hospital. A new wing was built into the Bristol site and named in the memory of the late Miss Catherine Walsh, who bequeathed £8,200 to the hospital. The closure of Penzance and the addition of the new acute wing meant that all services, including medical, surgical, paediatric and midwifery, were, for the first time, being provided from the one campus. Bill Dudley was the first maintenance worker at the hospital and, in his 23 years in the job, experienced many periods of change.
When I first started work there in 1963, for emergency power, we used to have a 25 kVA ex-army lighting plant for the emergency lighting in the hospital in case of a power outage. This generator required manual operation, could only supply 10% of the hospital needs and was unreliable. In 1983, $10,000 was raised at the hospital Sunday appeal to purchase a new generator which powered the entire hospital. I also remember the time of the briquette boilers at the hospital. We used to have to get the briquettes brought in inside bags on railway trains. Twice a week we used to load the briquettes onto a trailer and use a hydraulic lift to load them into the hopper. It was time-consuming, heavy work, and when we got the oil boilers, it was a great advantage.
In the years that followed, the hospital continued to develop, and in 1970, further additions took the bed number to 35. During the 8-year period between 1962 and 1970, the daily bed average had risen from 21 to 29. 1971 marked the beginning of two vital new services at the hospital: domiciliary nursing and district nursing. The Numurkah District Nursing Service was established with the hope of providing better care for aged people in the district, to relieve the bed position of chronic cases and to allow more bed space for the turnover of acute patients.
I've seen huge changes in district nursing over the years. When we first started, we did everything. I remember one patient we visited. We would chop her kindling to heat her wood stove so she could have warm water for a wash. If there was ever a thunderstorm, she'd call us and we'd have to go and cover the shiny bed ends, as she was worried the lightning would get in. The senior district nurse would even buy her a cask of sherry because that's what she wanted. Everything is so different now. There are so many other services that come in that we don't see that sort of thing now. Back then we did everything for people.
In 1972, a provisional committee under the auspices of the Hospital Board was formed to establish hostel services in Numurkah. a plan was presented to the public for a $210,000 hostel for the aged, and a community fundraising appeal commenced soon after. This committee successfully oversaw the construction and opening of a 33-unit hostel in 1976, the Numurkah Pioneers Memorial Lodge. A significant contribution was also made by the Numurkah Shire Council, which filled the site and provided funds from its own resources, an unemployment relief scheme to connect all water and waste services below floor level. This was to value of $30,000. Immediate past Deputy Director of Nursing Kerry Swan commenced work as a general ward nurse at the hospital in 1977 and remembers when the hostel was low care. 6 years later, in 1982, the Hostel Committee constructed a 20-bed nursing home named Bala House. This facility was financed with $242,000 in federal funding and a further $120,000 contributed by the community.
So in those days, residents at the hostel still drove their cars. They did everything for themselves. It was really low care. We didn't have a high care service until Bala House. Before the lodge and Bala House existed, we had a nursing home beds in the hospital. We had a room of 4 beds at each end of the hospital ward, and I remember elderly ladies being there who were like part of the family because they'd been there for years and years and there was nowhere else for them to go. We used to do everything for them, including putting their hair in curlers and have parties with them. You couldn't help but be close to them, spending so much time together.
Meanwhile, back at the hospital, growth in the town meant the health service was gradually outstripping its facilities, and major works costing $400,000 were carried out in the kitchen in 1974. Upgrades to the theatre and casualty area took place in 1976 and 1981, and the support service block in 1983.
In my early days at 6 a.m, the busiest time of the day with medicines and bathing, we used to have to run down and let the milkman in, turn the ovens and the stoves on. In those days, the patients had cooked breakfasts. This was one of our many chores. We would have theatre most nights, so a lot of cleaning up to do. One of the doctors here used to do a clinic at Catamatite. After finishing, he would come at midnight to do his rounds at the hospital. He would have his Milo and go home.
In the late 1970s and early 80s, Numurkah District War Memorial Hospital was renowned as one of the most experienced in Victoria for its management of snake bites. As a junior nurse, fresh out of training, Kerry said it was an exciting time to be at the hospital.
Numurkah Hospital was definitely very highly regarded as one of the most experienced for managing snake bites in Victoria at one stage. I remember one incident where a 3-year-old girl had been chasing a cat under the bush and she was struck on the chest by a snake 3 or 4 times. When she was brought in, we suspected it was a tiger snake because of the repeat bites across her chest. Tiger snakes are very aggressive, and that's why they suspected that's possibly what it was. We gave her the anti-venom and sent her on to Numurkah Base Hospital. They thought we'd overreacted, as no one had really seen the snake that could verify it. The child kept telling us it was purple. In those days, we didn't have all the testing that we have currently, and as a result, we at the time pulled off blood samples over a 30-minute period and would put them into plain blood tubes. And the first samples would clot as per normal within a minute or so, but by the end of 30 minutes, the samples were thin like water, and that's how we knew that the patient had been envenomated.
In 1989, major renovations to the residence owned by the hospital provided a permanent home for adult day activity and support services, and Board of Management agreed to a 2-bed reduction in the registered number at the hospital, reducing the number to 33 beds. That same year, on Wednesday, November the 1st, there was a scare at the hospital when gas began to escape from the 5,000 litre supply tank. Numurkah Funeral Director Peter Cox worked at the hospital as an electrician from 1975 until the mid-1990s, and received a call around midday to an emergency at the hospital.
I was a member of the fire brigade at the time, and I was at the Numurkah show, and we got a call out to a gas leak at the hospital around midday. The gas cylinders had just been refilled and the seal gave way. The gas was escaping through the cracked seal under the contents gauge. One of the maintenance officers at the hospital, Paul Rees, was the captain of the fire brigade at the time, and he could smell something that he thought was gas just outside the midwifery window, and the full alert was given. Luckily, Paul was there at the time as he knew exactly what to do. An emergency plan was prepared to evacuate some of the patients in case the situation worsened. Luckily, we avoided the need to evacuate the hospital, but the police helicopter was flown in from Melbourne to bring a special hose to decant the gas. Turned out the hose didn't fit, so we had to stand by until late in the night and let all the gas go. This event was on the 25th of the 9th, 1989.
1990 saw the completion of a 10-bed extension to Bala House nursing home, taking the total accommodation available in this home to 30 places. In 1991, land was purchased at the rear of the hospital for future expansion, and a large storage shed was constructed adjacent to the existing workshop. Also during that year, the Victorian Health Department provided a grant which enabled the cool room facilities in the hospital food services department to be upgraded.
Hi, 10 years ago we were in the old kitchen and the boss was heating up some oil in a pot, and he left the kitchen and to check on something, and I looked around and seen the flames, and huge flames and in the pot, and they were going up to the roof. I grabbed the fire blanket, threw it straight over the flames, and was trying to turn off the gas, the exhaust fan at the same time. Didn't have enough hands. One of the staff was yelling out, do that. Then the maintenance men came and took over, and lucky because of our great training, and we were able to put it out ourselves and avoid the need to call the fire brigade. We had to throw all the soups and the pots and everything that was on the stove at the time that were prepared for the day and start over again.
Following the 1992 annual appeal, midwifery facilities in the South Wing were upgraded with the conversion of the old plant room to a sitting and feeding room and the enclosure of an outdoor garden area. The delivery suite was totally renovated to include a spa bath and feature window. Gail Grinter has been a midwife at Numurkah since 1983, and along with Fiona Weeding, is one of only 2 trained midwives remaining at the health service today.
Well, in the early 80s when Fiona and I started working in midwifery in Numurkah, it was really great. Women used to come in and have their babies, and they'd stay for about a week for a normal birth and about 10 days for a caesarean birth. So we got to know them and their families really well, and they'd come back for their subsequent babies, and we became quite good friends with them, and we'd often see the mothers and children down the street. We got to follow their progress through life, and yeah, you always feel a special bond to the mothers that you've helped during birth, so that was really nice. We did do some fairly awful things to the mothers. It was standard practice that when they came in, we'd give them an enema and shave them, and they'd lie on their back to give birth with their legs up in the stirrups. It was very undignified, but fortunately things have changed for the better since then.
Over the years we had quite a few mothers deliver babies at home, some on transit to the hospital. One arrived in a mini minor and was too close to birth, so the midwife delivered the baby in the mini minor. Also we had another mother arrive in a 4-wheel drive, but the baby was already born, and she said she was going to call the baby Nissan.
Yeah, it's always a challenge knowing when to phone the doctors. We always let them know when the birth was imminent so they could be present to help in case any problems occurred. During the night in particular, we try to preserve their sleep and only ring them at the very last minute, but sometimes birth's unpredictable and the babies would fly out and the doctor would miss it, or on occasions the doctor would doze back to sleep for a couple of moments after the phone call and once again he'd miss it.
And I started at Numurkah Hospital. One of the other midwives, Kay Jensen, told us a story about a woman in labour couldn't get to Numurkah Hospital during the 1973 floods. She presented at the fire brigade where they put her on the engine and brought her down to Numurkah Hospital so that she could deliver safely at the hospital through flood waters.
A large modern steriliser for the theatre department was purchased with proceeds from the 1993 annual appeal, and an elevator X-ray table was purchased following the annual appeal in 1994. In 1995 and 96, the aesthetics of the hospital were greatly improved following the application of masonry veneer to several external walls and the subsequent painting of all exterior surfaces. Further enhancements were also made with the construction of a front entrance canopy. Sue Aldridge worked in administration at the hospital for 35 years between 1970 and 2005 and experienced significant changes during that time. She said in the early days there wasn't the emergency nursing or the paperwork that exists today, and some nurses even found time to knit and iron whilst on night duty.
There also wasn't such a thing as maternity leave back then. If the nurse happened to have a baby of her own and couldn't find someone to mind the child, she would bring the baby in and we would look after it in the office. We also used to get free 3-course meals back in the 1970s. Then the health department stepped in and directed that no staff members were to receive free meals. After that time, I remember the nursing staff used to bring in frying pans and they would be cooking their own chops for tea in full view of everyone. Everyone just accepted it and laughed about it. In the 80s and 90s, things started to tightening up, and this sort of thing no longer happened.
During May 1996, site works commenced for the construction of the Numurkah District Community Health Centre. This building was officially opened on Friday the 1st of November 1996 by the Honourable Dennis Napthine, MP. On the 1st of July 1997, contracts were signed for the upgrade of the casualty and radiography areas within the hospital, and works in these areas were completed in February 1998. On September the 30th, 1997, Numurkah District War Memorial Hospital changed its name to Numurkah District Health Service under recommendation of the Minister for Health. The logo today was developed in the early 2000s to reflect the newly declared Numurkah District Health Service. The previous logo was designed by nursing staff member Kerry Swan and captured the history of the Numurkah District War Memorial Hospital that was proudly displayed at the front entrance. It was removed prior to the demolition of the flood-damaged hospital and is currently in storage.
The hospital's name changed because the board was looking to the future. We all knew the days were numbered for hospitals our size because we couldn't give critical care and we didn't have doctors on site. We were looking to services like district nursing and community health, and we were no longer strictly a hospital. So we looked to a name that would encompass the changing service. There was resistance to the name change because, after all, the hospital was originally a memorial dedicated to those who served at war. The existing name was left on the front entrance and has remained there until the present day.
In 1996, the first stage of the independent living units were built in Gwendolyn Court, and over 7 years, 11 were completed. These units have enabled many local farmers and town residents to stay in their community as they downsize in retirement. In 1999, the palliative care suite was completed, built with contributions from the Department of Human Services and the local community. The suite provided important care and appropriate accommodation to those in the end stages of terminal illness.
In 2001, the Department of Human Services funded a feasibility study and master planning to totally redevelop the Numurkah District Health Service site. This planning process incorporated bringing the beds currently located at Numurkah Pioneers Memorial